These biofibers are generated by bacteria and have the ability to emerge from the skin and other bodily tissues. They exhibit a wide range of colors, and upon closer inspection, one can even observe subtle movements. What makes this condition so perplexing is its unpredictable manifestation and complex symptomatology. Today, I would like to talk to you guys about Morgellons disease and how this condition may be more common than you think. A lot of medical doctors and healthcare practitioners that are treating tick-borne disorders, they know that there are about 400 to 500,000 cases in the US alone of Lyme disease each year. Of these, there is an estimation that 4 to 5% are Morgellons cases. So it may seem a little, but when you say it that it is 18 to 25,000 cases of Morgellons each year, it seems like a lot. So what is Morgellons disease? Morgellons is a atypical dermopathy that is associated to Borrelia. And all of Morgellons patients will have a diagnosis of Lyme disease, but not all of the Lyme disease patients will have a diagnosis of Morgellons. The activity of this condition can also be triggered and affected by other conditions like Babesia, like Bartonella, like Anaplasma, like Ehrlichia, and Morgellons features are the production of crystals and fibers that can be emerging from different tissues in the body. The most common is emerging through the skin, and then through the mouth, through the ears, through the urinary tract, and in some cases even through the eyes. When these fibers are emerging through the eyes, we will see corneal abrasions. Common symptoms of Morgellons, in addition to what I mentioned, is fatigue, confusion, trouble with remembering things, head pressure, headaches, anxiety, joint pain, and crawling sensation throughout the whole body. In addition to the skin scabs that we'll see in the majority of the patients. These skin scabs will often have emerging fibers, which are the things that are creating the skin scabs in the first place. Due to the unconventional clinical manifestations of Morgellons, it can oftentimes be misdiagnosed as a dilutional parasitosis. This is obviously a big mistake, and a lot of patients get missed this way. Current published literature on the subject is very scarce, so there is not a real consensus on the diagnosis, let alone on the treatment. So patients oftentimes have to rely on other fellow patients for some opinions and recommendations for treatment. To give you an idea of how this all works as a patient, I have asked two of my patients, one that is a current patient and another that was a patient 2 years ago, to give us their feedback on how this condition feels and what they've been through.
So I was already bedridden when a bullseye rash appeared, and I had been sick for decades and actually became legally disabled. But although I had a slew of diagnoses and a number of operations, no doctor could ever help me understand the genesis of all of my illnesses. That's what the second tick bite actually did for me. I was bit in the fall of 2021. I'm grateful for the bullseye rash because it actually led me in the direction of Lyme disease. Suddenly I knew what it could be. In seeing the doctors here though, they said, no, there is no Lyme in Arizona, so you can't possibly have Lyme disease. So I became labeled with delusional parasitosis and was totally denied treatment, even though I was begging them for help. That infection ramped, and I still didn't know what it was, but it went into my eyes, and it was scratching my corneas so badly that I began to lose my vision. The pain was absolutely unbearable, and I finally realized that I had to help myself because no doctor was going to help. So I went to Amazon and I purchased a microscope, and I would flush my eyes out with saline and put a paper towel under my eyes to catch the debris. I knew there was debris in my eyes. And when I looked at it under the microscope, it was stunning. There was fibers in a variety of colors, things that shouldn't come out of your eye. There was actually like glitter. It was bizarre. and I tried not to be scared to death. I had no choice but to go to the internet and try to find some support groups. It was pretty quick that I was able to discover that it was something called Morgellons disease. And as I read the symptoms and the stories of people who were suffering, I realized that I had had it all along. It was just undiagnosed, along with the Lyme that was undiagnosed, and a number of other co-infections. Luckily, I went online and I did find a place that was treating Morgellons, and that was Dr. Morales at Lyme, México. So I was able to contact him, do a consult, and it just sounded great. So about a month after I was bit, receiving no help from doctors here in Arizona, I got on a plane and I flew to Mexico. I feel like I fled to Mexico to save my life and to save my vision. And luckily, that's exactly what happened. I received about 6 weeks of treatment there in Mexico, and it's not an easy course. Treating Lyme disease and Morgellons is not something that's like a walk in the park, but it made all the difference. So I continued treatment when I got back home, consulting with Dr. Morales, doing the protocols that he gave me, and now it's almost 2 years later, and I am about 90% symptom-free, particularly of the Morgellons. I can see again. I had to wear bandage contacts for about 6 months. That meant that the doctor that I found in Mexico, the only one that would help me, that actually the staff at Lyme Mexico helped me to find a doctor, which I was super grateful for. And she allowed me to stay in the bandage contacts, giving me antibiotic drops that I stayed on for 6 months, along with all of the other treatments that I was doing for the Lyme and co-infections. And eventually I could remove those contacts and I don't have to treat my eyes anymore. I had to treat the Morgellons disease systemically, which I've done. And again, I would say 90% better. The whole reason that I'm doing this video is to let people know out there who are suffering that there absolutely is hope. I see so many people that are despondent from this, and I get it. I was there, but I'm living proof that even after decades of disease, you can get better. I've got my life back. I'm attending events with my family. I went to my 40th high school reunion. I'm absolutely participating in life again. And I just wish that all the people who are suffering will be able to find relief and find help and get on the road to wellness, both, mind, body, and spirit. Blessings to you.
Hi, my name's Anthony, and I am a sufferer from Morgellons disease. I have seen fibers growing, coming out of my skin. I've had the strangest, some of the strangest symptoms. I'm not even really sure I want to get into all of them, but I mean, I know I feel crawling sensations, used to, previously, scalp crawling. I've seen hairs pop up and disappear under my skin, like along my veins, as something seemed like it was moving. Very little sleep. I was lucky if I got an hour and a half at best straight, maybe 2 of those a day total, up all night. Couldn't concentrate at all. I've even stopped mid-sentence trying to remember what I was talking about. That's how bad it got, the brain fog. I know what it's like to be hopeless, to feel that complete and utter hopelessness. But there's people out there that are educated in what I've been going through and what I'm beginning to believe so many others are going through, that don't seem to find anyone other than group chats online to where they can share their stories and their pictures and know that they're going through the same thing. And that means so much, because I know there are people out there that went a lot longer than I did, never getting diagnosed, or worst case, or taking years, decades even, to find out what's really going on. I found Lyme, Mexico through a doctor in Nashville that is a part of the same organization, iLads, on YouTube. Found him on YouTube. I started just typing in the iLads, and Dr. Morales came up, and I am forever grateful. I've been here 1 week and a detox week, and I feel like a new man. I do. I've been sleeping through the night. Well, not through the night, but when I wake up, I have the ability to go back to sleep. I've slept 7 hours last night, 7 total. That's more than I did in 4 days prior. I haven't seen any manifestations of these fibers. Feeling starting to come back in my big toe. Seems these cysts that have formed under my skin where these things decided to break through are at bay. And if this first week is any indication, the trajectory is straight up. I mean, my mother, everyone I've spoken to says, man, you sound like a new man. I said, the most beneficial treatments to date, just in the week, have been the plasmapheresis for sure. Day 1 I had that. And the hypothermia, which I had about 6 hours ago. Made it up to 103.1 degrees for about an hour. And when I walked out the door here in Puerto Vallarta, it felt like a winter day. Those by far, to me, have been the most effective. You're not alone. And if the medical community would start to educate themselves and not look at things with such blinders on, like they have, I think, about other maladies in our history, and then realize, hey, wait, we were wrong. I wish they would come around and do this a lot faster, because there's a lot of us out there that never get diagnosed.
Some interesting facts about Lyme and Morgellons, which we are excited about and we want to share, is that most individuals suffering from Morgellons illness have had Lyme disease at least a decade prior. So this suggests the existence of a predisposing factor connected to the prolonged nature of Lyme disease. Pathology reports of Morgellons in biopsies taken oftentimes will show 3 things: Borrelia colonies, macrophages, and hyperkeratosis. So what is hyperkeratosis? Hyperkeratosis is the result of hyperkeratinization or hyperactivity of inflammation or autoinflammation in the skin that leaves an excess of keratin at the end of that process. And one theory is that perhaps individuals harboring genetic mutations such as IL-36RN, CARD14, and NLRP1 genes, which are associated to hyperkeratosis, might be inclined to develop autoimmune inflammation and hyperkeratinization following prolonged exposure to specific strains of Lyme disease. So this is key. Maybe by searching those specific strains and understanding these genetic markers, we may come to a good solution or some kind of important breakthrough in the treatment area. I've been treating diseases like Morgellons for over 10 years, and we have been able to develop some very successful treatments, especially these 3. Immunotherapy or immune modulation, number 1. Second, an IV cocktail of silver, antimicrobials, and antiparasitics. And third, given by hyperthermia. What is hyperthermia and why are we combining it with the IV cocktail? Well, because hyperthermia is a whole body treatment that increases the patient's temperature, and when those levels of temperature are achieved, some Morgellons tends to die, and additional to that, the delivery of the cocktail is improved up to 16-fold. So we have a really good combination with those 3 treatments, and hence why we have successful cases. We are teaming up with UNAM, one of the country's most important and prestigious universities, to develop studies on understanding the physiopathology and molecular manifestations of Morgellons in the phase 1. And in the phase 2, we're gonna chart out some good treatment options. We're also teaming up with the Center for Nanoscience and Nanotechnology for this endeavor. Please let us know if you have any further questions on this subject, and thank you all for listening. I hope that you enjoyed this video, and please let us know what else you would like to hear about these conditions. I hope that everybody has an excellent week.